Greetings to all viewers. Today I wish to speak about menopause and related problems. I'm Dr. Shobna Mohandas, a practicing gynecologist in Thrissur, Kerala. Menopause is something which comes on you gradually, and a lot of people do not know that it is associated with a lot of symptoms, and so they do not know how to handle it. They think it's normal and there's no help. So here goes. There are a lot of hormones in the body, which are estrogen, progesterone, and androgen. All of them start fluctuating around the age of 45, and people can go into menopause by 46 to 55, varying ages. In India, the age is 46. When these fluctuations happen, a lot of problems happen in the woman. Fluctuations in estrogen in the transition phase of menopause causes hot flashes, mental disturbances, depression, lack of sleep, feeling tired, which they ascribe to their surroundings and not to their hormonal problems. What are hot flashes? No, there is a feeling of very lot of heat in the face and upper part of the body, and it may be accompanied by sweating even in the middle of the night. So it may last for a few seconds and it may go up to the chest and you may get palpitations, and it can really be very severe in a lot of people. And this really requires hormone therapy. A lot of people are scared of hormone therapy, and a lot of people have very few symptoms. In both these places, you can actually take plant estrogens. The highest estrogen content is there in flax seeds. You can make idlis out of it. Soya beans has got 1 lakh, as you can see. It can be, taken as a sabji, or you powder it and put it in your chapati dough. Sesame seeds are good, and our own tilgul is very good uh, for menopause. Garlic, not to the extent that flax seeds and soybeans have, but it does have 603. Sprouted beans, dried apricot, peanuts, almonds, dried dates, your own singdana or things, beans, onions, blueberries, not very common in India, but basically soya beans, flax seeds, your sesame seeds. They are very high in phytoestrogens, and if you can take lots and lots of it, even your chana and your peanuts, they are also available in green leafy vegetables and all the legumes. Basically, even the Bengal gram has got a high content of phytoestrogens. So, if you can take lots of it, to some extent, you can reduce your hot flashes. And besides, you besides hot flashes, you can also have bleeding around just before menopause. And you have to check whether you have got fibroids or any other things while this is happening. And if there are no fibroids and if the DNC or endometrial biopsy does not show anything, you can either take medical treatment, or there is something called Mirena or LNG IUD, where hormones are released directly into the uterus. Many patients don't know about it, and it's just costing 3,000 to 4,000. So in places where bleeding is caused just because of the hormonal changes, this is a hormone releasing IUD which can really help you. Now, when you have hot flashes, there is a myth that hormone therapy in menopause is bad. Sometimes the bleeding comes along with hot flashes. So in those patients, it would be good to put a LNG IUD inside the uterus and give hormone therapy for treating the hot flashes. So your bleeding is also stopped, the hot flashes is also stopped. Giving hormone therapy in menopause is very safe up to 5 years. And for God's sake, your hot flash is not going to last for 5 years. It's maybe lasting only up to 2 or 3 years. And that's about all the time that you have to take the hormone therapy. And it's not going to cancer. It's not going to cause all that many problems. So the truth is that the women suffering from menopause related symptoms should Definitely take medical hormone therapy either orally or as ointments, which are little costlier, but they are having less side effects. So hormone therapy should be taken by patients who have hot flashes. Besides hot flashes, the SWAN study, it's a study which studied the sleep disturbance pattern in younger people and older people. And they found that 40 to 56% of people in the peri and postmenopause did have sleep problems. It's not just about the mobile phone and the checking up of, messages till late. It's the age related difficulty in falling asleep. And for this, you must follow a sleep hygiene where you avoid heavy meals close to bedtime, so don't have late dinner parties. Avoid vigorous exercise close to bedtime. Avoid naps during the daytime. Limit drinking tea or coffee throughout the day. Also, in the elderly group, enjoy the company of people and places you love, whether it is bhajans or whether it is a music concert or whether you want to go for movies, whatever it is. Enjoy the company of your peer group and sit with them, and that will give you mental happiness. Meditate somewhere and sit quietly with your eyes closed, imagining the sights, sounds, and smells of your favorite place. That will reduce tension. Make time for music, art, or other hobbies and just smile. That will really help you to relax and worry. Stop worrying. Research has shown that having close, confiding relationship protects you from many stresses. You can find wrong things in everybody around you, but you have to forgive people and continue to have close relationship, and that can protect you from many stresses. Sleep pattern today, we should know that beside all these simple remedies, if the sleeplessness is really tough, there is something called a CPAP mask and a CPAP machine. And for really bedridden patients and people who are really having a lot of trouble, you should know that these gadgets exist, and a pulmonologist or a physician can help you find it and get your sleep corrected with a CPAP mask. Besides sleeplessness, menopause does lead to vulnerability of depression. You feel like crying for no reason. You start blaming everybody around you. And for this, hormone therapy won't help. This is one thing where you need antidepressants because it is because of decreased chemicals in the brain. Although it does happen at a time when there is fluctuating estrogen, estrogen therapy will not treat depression. So that requires antidepressants. Also, unwanted anxiety for no reason, not because you're jumping down a seesaw or something like that. For no reason, your heart is pounding and you're anxious. It does require medications and not just hormone therapy. What else will require hormone therapy besides hot flashes? A lot of women in the middle age or older age around menopause will have itchy labia, painful sex, vaginal discharge, difficulty going on wanting to go to the toilet all the time, painful micturition. All this is caused by lack of estrogen in the vagina and the bladder. And there are ulcers in the vagina. So how can you? What else will happen? Some people have involuntary urination, by just when they cough, they start passing urine. Painful intercourse. All these are problems which happen at this age group. For this, you need to take either lubricating creams, or if that doesn't work for sex, vaginal hormone creams for even your bladder problems. Little bit of estrogen inside your vagina daily or twice a week will go a long way in improving all these painful symptoms, and you should be aware of it. Involuntary passage of urine, you should know that there is something called Kegel's exercise. There are vaginal cones available online which can be placed inside the vagina while you do the exercises. If all that doesn't work, there is a surgery to treat the stress urinary incontinence. Urge incontinence is another thing. Yeah, older ladies can't travel because they need to go to a toilet every now and then, and Sometimes they even need to take a panties, and you really can't stop travel a lot because of this constant desire to go to a toilet and not being able to control your urine. You need not suffer this. There are medications which can treat urgent incontinence. Quite often, it is caused by uncontrolled diabetes. People are so bored of controlling diabetes from 40. By the time they reach 70 and 80, they don't bother about the control of diabetes, and that can also lead to urgent incontinence. So, medications to control diabetes, medications to control urination are available. Use it. You do not have to suffer the situation of urge incontinence or unable to control your urine by the time you reach the bathroom. So, it is treatable. Now, besides all the hormone therapy, we know that from 35 onwards, the bone starts going down. Every year, there is a 1% drop in the bone, even at 35. By menopause, it is 5%. And even the muscles are lost from 35 years on. So you don't have to wait till you're 80 to lose your muscles. So what you have to do is to look after that muscle strength, pain, and this lack of strength in the bones will lead to painful joints, degenerations in joints, and degenerations in bones. So to strengthen them, you need to take calcium from childhood. Your mother should be taking calcium. 1500 milligram per day is the dose in the old age. Vitamin D should be taken. Magnesium, folic acid, vitamin C, and a lot of strength training exercises can help build bone. And this should start from 35 years of age. You should walk, run, swim, and your strength training exercises at least twice a week so that the bones are strengthened and your joints by default will be strengthened. Traditionally, women used to exercise, and now that exercise is lost to just drinking alcohol and having parties. And that is what is leading to all that lot of osteoporosis. What we used to do in our past in the river sides, nowadays we are doing it in the gyms. Never mind, even if it is in the gyms, do it. Remember that this was a lifestyle before. You can't get rid of it just because you have parties. So you have your parties, but please do go to the gym or make it have a group where you can go for exercises or running or something. Otherwise, your bones will go, and you will start stooping and you will need a walking stick. Now, besides loss of bone, lack of exercise also leads to increased fat, basically around the tummy. All the fat comes around the tummy, and then people start worrying if there is a tumor inside the abdomen. It's not a tumor, it's just that as you grow old, all the wisdom gathers around the waist. That's how you can say. So you can't get rid of that. So it's also because of decreased physical activity, not just menopause. There is a decreased resting metabolic rate. If a 20-year-old runs 1 kilometer, and if a 50-year-old runs 1 kilometer, the 20-year-old will burn more calories, whereas a 50-year-old will not burn that many calories for the same distance. And sitting idly also leads to increased eating in that age group. So all this leads to obesity. Besides exercise and dieting, which is mandatory, you have to eat less as you grow older. But all the inflammatory changes, like bone joints, cough, whatever obesity brings you, that can be allayed by fruits like lychee, guava, jackfruit even. So these are the advantages. Avocado, mangosteen, pomegranate, bakul fruit, all this can actually reduce the inflammation caused by obesity. So obese women should be taking more of these fruits. You also know that men tend to die at a younger age, just like that of cardiac fitness, but women die of cardiac problems only after menopause. That's because estrogen protects the heart of a woman when she's young. But once she has attained menopause, that protection is lost. And so we have to work extra to maintain the heart. And you have to have 20 to 60 minutes of continuous or intermittent aerobic activity like running, swimming, or something like that. You can split your exercise bouts into 3 bouts of 10 minutes. That's also good enough. While eating, besides eating less, you should avoid trans fatty acids as they are more dangerous than saturated fats. They increase the bad cholesterol, LDL cholesterol, and decrease good cholesterol, which is the HDL cholesterol. And then that increased fatty acids in your body can lead to heart attacks. You have to avoid non-khatais because they are manufactured with vanaspati containing trans fatty acids. But there is less trans fatty acids in oats biscuits, glucose biscuits even. So cookies and samosas all will have trans fatty acids. Basically, buying food from outside also will have a high trans fat acid content, and a 2% increase in energy intake from trans fat acid has been associated with a 23% increase of the risk of heart disease. So you just eat a little more and your chance of dying of a heart attack is increased 23%. Repeated heating or frying is done by people in the restaurants, and that will also increase the trans fatty acid content. That's why when you eat from outside quite a lot, you may get a trans fatty acid content increasing and heart attack. The, the there is a clear statement that oil should not be reused more than 2 to 3 times. After that, you throw it, or you finish the oil off by the time the third oiling is done. Some things like almonds, when eaten in moderation, it can reduce cholesterol. It also contains vitamin B7, E, and minerals, and magnesium, iron, zinc. All sorts of good monosaturated fats are there in this almonds. Vitamin K is there in tomatoes. It can reduce heart attack. Rolled oats contains beta glucan, which is a soluble fiber that helps to bring down the cholesterol, especially LDL in the body. So that's why the fashion of eating oats with vegetables is coming in the market because it can avoid heart attacks and it is a healthy way of living. Apples, all sorts of cereals, vegetables are all heart friendly. So finally, if a woman has got hot flashes or vaginal problems, hormone therapy should not be denied. When a woman is debilitated with osteoporosis, I did tell you that exercise should be taken. But if she's lost all her bones, remember there is something called parathormone, which is a injection around 5,000 rupees for day, 1 whole month's injection. It can be taken like an insulin syringe. And all your bedridden patients may be given this injection. It will enhance the bone formation and prevent having home nurses at home to look after the bedridden patients. If you can improve their bone strength with these injections, you will go a long way in helping them out. Many people don't know about the use of parathormone, and therefore they do not use it, and the poor women are lying in a wheelchair without proper help. So the public need to be know that there is something called parathormone which can build bone. All other medicines used in osteoporosis will prevent the fall of bone. But parathormone will not prevent the fall, it will actually build the bone. And this is very helpful in bedridden patients or patients on inhaler therapy or glucocorticoids. In patients with menopause, mental problems have to be addressed not with hormone, but with antidepressants or sedatives or anxiolytics. To prevent cardiac events, lifestyle modification should be done. Urinary problems should be addressed with local estrogen creams and particular medications for that. I just wanted to tell you about a few things that can happen in menopause. It's a vast subject. Just touched upon a few of the important topics, I hope. you will benefit by this talk. Thank you so much.